So we're going to go to some questions here. I think in both food and drugs, we're grappling with the challenge of informal markets. And I think it'd be fair to say that we want a system that does less of the things that make the problem worse, perhaps, and more of the things that might make it better. And so I think we have now a good chunk of time to explore what those things might be. So I want to, let's start, yes, with Mikel Arriola.
Hi. Well, I was a regulator for 5 years, and after hearing you, I'm quite scared. So, first, one of the affirmations by Delia, and I would ask why and what's your data that the worst is yet to come in terms of food market and informal markets. And the other thing, well, maybe both in terms of medicines and food. Seems like every one of us is part of a conspiracy theory, no? And I don't think that's rigorous. I have a couple of data here. Per capita consumption of medicines, according to the World Bank, has doubled in the last 20 years. So that means that general population is having more access to medicines. And deaths from diarrhea in the world are reducing or have fallen every year since maybe 30 years ago. So my only question is, where do you get your evidence in terms of this kind of theories?
Why the pessimism? Maybe, go ahead.
I should say that our evidence is not as strong as we would like, and partly it's because foodborne disease has been incredibly under-researched, especially in comparison to diseases of comparable magnitude like malaria, HIV, AIDS, or TB. It wasn't really till the FERG, the Foodborne Disease Epidemiology Reference Group of the WHO, produced the first global report, which was released in late 2015, after 10 years in the making, that we really started to get a bit of a handle on the burden of foodborne disease. So this is quite new. So the worst is yet to come. That comes from two sets of evidence. The first is, as we say, we know epidemiological transition in general, infectious diseases going down and more non-communicables and all the rest of it. So that's why we have to explain why foodborne disease isn't following this. The one set of evidence is that in countries where they have pretty good data on foodborne disease, you're not seeing good dramatic increases, even though there's a lot of investment in regulation, there's effective regulation. CDC does these report cards where they tell you what's happening with some lead, E. coli, Campi, whatever. And if you look at those, you'll see that over the past 10, 15 years when they started, there's been no overall change. Some have improved a lot, some have got worse a bit, no overall change. We see the same thing in Europe, where again, the EFSA has got reasonably good data. There have been islands of success, but there hasn't been an overall clear decline in foodborne disease. The other area this comes from, and this is work we've been doing with Wageningen, is looking at these models which track consumption into the future. And it's very clear that we have what are called livestock revolutions, blue revolutions, white revolutions, and that these foods are increasing. Per capita consumption of these fresh foods are increasing. There's another set of evidence which is on attribution. So when you get sick, what made you sick? And it's pretty clear that it's the fresh foods, especially animal source food, livestock products first, fish next, fruit and vegetables third. Those are what are making you sick. And so if you run these models into the future, predicting future consumption against food attribution, you get an increasing burden of foodborne disease. And that's not even taking into account the third thing, which is what we did with Steve and Spencer, this life cycle. The messy middle. It gets worse before it gets better. When you're in a really poor country and your only food is your only meat is one chicken once a month, and it's in the yard in the morning and you cut its throat and you boil it in the afternoon, there's not many things which can go wrong in terms of hazard introduction. But when you're getting your chickens from somewhere in a messy peri-urban area through an informal market, through 10 different and then it's been cooked because nobody can afford a whole chicken, so you're having to buy a bit of a chicken. I mean, from a food safety perspective, it's just so easy to see how hazards can get in and multiply and be difficult to control.
Okay. Thank you. It seems like one theme is that surveillance data would be very important to understanding in this particular topic. Listra?
Just on the very interesting discussion on both food and drugs, and I'm wondering, where does the consumer and the role of the consumer factor in to regulation of informal markets?
Thoughts about that? Anybody? And Spencer, if at some point you can, we don't have a picture of you anymore, but if you could, you should feel free to pipe up if you want to talk in response to a question. But I think Gugu is gonna.
Yes. I mean, I think.
Oh.
I mean, on the informal market side, I think we need to look beyond the food area to informal markets in general, the role of regulation, the way in which incentives do or do not get put in place that drive the quality of products and the safety of products. Because as Delia said earlier, there are mechanisms in place that exist in those markets across many quality and safety dimensions that actually work quite effectively. So it isn't that these markets are not regulated. It's not that there aren't controls in place. There aren't incentives in place. And I'm not suggesting for a minute, that everything is wonderful and great, but it isn't. We can't see these markets as being unregulated.
Well, I think the question sort of gets at that complexity a little bit, and maybe I'll just turn to Gugu for your comments. I mean, I think the question, and I'll come back to you, Spencer, I don't want to cut you off here, but when you think about the consumer in informal markets, I think a really important question is the consumer, interested in more formal food safety, or is the consumer not interested in more formal food safety? In the United States, for example, we have consumers for certain markets in food that are very strongly opposed to more formal food safety, and I think of unpasteurized milk as a good example. In some cases, quite aggressively opposed to a regulatory system around that. So, as you look at this, the informal market, how do you think about the role of the consumer?
Specifically when it comes to medicines, I think the consumer resorts to the informal market because of the situation that they sometimes find themselves in. I think we can also use them as regulators by educating them, for them to understand the hazards of dealing particularly with medicines in the informal sector, because you don't know how those medicines are stored. You don't know the source of those particular medicines. I mean, unlike food, milk that is drawn from a cow, and that's my neighbor's cow, etc. It's slightly different when it comes to medicine. Somebody has to manufacture these medicines. And sometimes we find, particularly in the veterinary sector, for veterinary medicines, that there's a lot of counterfeiting of branded products. So we have to then educate the farmers to be very careful in their purchasing of these medicines, so they are empowered to protect themselves.
How do you think about the challenge of maybe people wanting medicines that you don't think are safe? That particular consumer aspect, which happens in the United States certainly as well.
Okay, so that would not be what I would call your traditional, normal allopathic medicines. That would probably be complementary medicines or traditional medicines. Yes, we see a lot of that happening. And we decided we are not going to be in any state. People should make their choices. If they decide that is what they want, the traditional medical practitioner is not actually regulated in what they dispense to patients, as long as they don't commercialize the product. The moment you start commercializing a product, that's when we want to ensure that that the product is at least safe, that it will do no harm. Might not do you any good, but it should not do any harm.
Well, on that last point, I will say one quick thing, then we'll go to Elizabeth and Delia, that the dietary supplement market in the United States is a topic of a lot of discussion. And there's some very interesting data that, by and large, something like 4 in 5 people who take dietary supplements don't really care whether the FDA thinks they work. However, 4 in 5 people roughly care a lot about whether the FDA thinks they're safe. So the idea that for certain types of products, that even there's consumer interest in safety, even if there isn't on the other side of it, may apply to some of these other medicines or products that are outside traditional medicine.
So in fact, we have what we call complementary medicines regulations, which includes the dietary supplements. And we insist that on the labeling, they should indicate that there's no there are no therapeutic claims on the products, etc. But we will have checked that at least the products do no harm.
Great.
We spoke to cancer patients in Romania who were buying cancer drugs on the street corner outside of the Oncology Institute. And we said, do you think these drugs are safe? And they said, no, probably not. They're probably really bad. And we said, so aren't you worried about that? You know, if you take them, you might die. And they said, I have cancer. I am going to die. There is no other source of medicine. So maybe these will work. And I think that when people are dealing with that, so we have to look at this systemically. It's about the health system. It's about access. It's about affordable access. It's not just about that, because you also have cases. So there was a big vaccination scandal in Indonesia in 2 years ago now, where 5,000 kids were vaccinated with fake vaccines. There was no unmet need in that market. The national producer, Biopharma, which is a WHO prequel producer, had stocks for everyone. They're available for free, but because medical service providers are incentivized to try and get people off the free drugs and onto paying drugs, they were pushing people onto paying drugs. GSK had a production shortage, and falsifiers moved in and filled that market. So it's not that people are actively wanting to take bad medicines always, but if they don't have a quality assured source of good medicines always, it's not that they're not aware, it's that they're prepared to take the risk very often.
Thank you. Delia.
Yes, I mean, I agree completely with both speakers, but just adding to that, it's not always just a question of no alternatives. It's also a question of trade-offs and preferences. So, for example, poor buyers in informal markets are very price conscious. They're actually quality conscious as well. That was surprised us, but we found they care about quality, but often they care about price more. And often it makes more sense for them to get a substandard drug which doesn't contain as much of the active ingredient, but I'm talking about veterinary now, but maybe 8 times out of 10 it works, 2 times out of 10 the animal dies if they have to buy an expensive drug, 10 times out of 10 the animal will live. But for them on a population level, that trade-off actually makes sense. It's a rational decision to buy the cheap substandard drug or the cheap substandard food. And when we get to the price of milk, remember if I said if you can give your kid 1 litre of slightly unsafe milk or half a litre of completely safe milk, you may be better off giving them the slightly unsafe milk. And I'm sorry, the last point from that, though, because it takes us back to the regulation and the market authorization. If there is a demand, if people have no choice, or if they have rational preferences, which the regulators don't agree with, you're going to get food and drugs sucked into those markets. And the more you try and punish, the more you drive it underground, and the worse the quality of everything will get.
Great. Veronica?
Yeah. Thank you very much for the presentations, fascinating. And it seems to be that there is a theme that is emerging of looking really into informal markets in a much more macro perspective rather than focusing very micro on an institution, which is a regulatory authority. Seeing the big picture and saying what is the context that is inducive for having safer products is really important. It goes much beyond the regulatory authority, and I think that's very important. Delia, I had a question regarding the example that you mentioned from Tanzania, the informal dairy producers. Is this...
It was just it wasn't any specific country.
Okay, it wasn't any specific country, sorry. Is this written up? Is this a case study that the committee could use? Because I think having illustrative examples of where things have changed and how things have changed could be really important. Thank you.
Sorry, yes, no, I thought you were talking about the conflict of interests between formal sector, which is dominated by political elites, and much of the food sector in many of the countries we work with is dominated by political elite families, whether it's intensive poultry in West Africa or dairy in other parts of the world. But the specific example of informal sector has been very well written up. It is one of the relatively few examples of some success. Basically, there was something called a smallholder dairy. In Kenya, instead of trying to get rid of the informal sector, they worked with it to try and make it better, bringing all the universities and people on board. They showed that the incentive there, as I said, was protection from harassment from authorities. When you went from being informal to being sort of quasi-formal, it was demonstrated that the milk was safer at the end of it, and the net savings from reducing transaction costs were equivalent to $26 million a year in Kenya. Now, we've come back 10 years later, and what we have found is that people are still getting protected. They still like the scheme, but they're still getting trained, but their milk now is no safer because the training has been turned over to entities. The initial training was done in a development project with a lot of oversight, and as the training became nationalized, there is now no difference between people who are trained and not trained, except that they are protected, which is a good thing.
Prashant?
Again, echoing what others said, this has been a good discussion, very rich in what we learned. I think one area that keeps emerging is we probably need to be very precise in the use of language on what we call as informal markets. Because what I'm seeing come out of some of the discussions here is it is hard to regulate informal markets. Some may argue we shouldn't even go down the path of regulating informal markets. But once again, it's not informality of the market which is a challenge. It is the lack of ability to regulate it well, or the resources required to regulate it well, which are the challenge. So should we, instead of saying informal markets for the purpose of the committee's work, think about labels such as less regulated or loosely regulated or unregulated market, which will have then some portion will be informal, because in the absence of that, there is a dimension here which is, we are trying to push for formality in markets, which is not the intent. If a regulator or if whatever our core functions of regulation can be achieved in an informal market, then informality of the market can serve to be a good thing. And so my question to the panelists is, when you've thought about informal markets and regulation, especially to Gugu, are there examples where you say, we can do very effective regulation of the informal market without having to convert the informality into a formal retail structure or anything what we call as formal in a Western sense?
Interesting question. So my take on informal is the term that we use in Zimbabwe for people that are not licensed. So if you are a retailer who sets up a stall and you're not licensed by the local authority, you're considered informal. So that's my take of what we call the informal sector. Anyone who doesn't have that trading license that is issued by the local authorities to be able to do that. I was reflecting on this discussion and actually sent an email to one of my colleagues to say, perhaps these runners that go across the borders, we should start thinking about actually authorizing them to do that, rather than because we're chasing, we'll never catch them. We will never catch them. In Tanzania, they had these dukaladawas, drugstores everywhere, and they realized they could not, they couldn't do anything about them. Right? So they brought them in and regulated them and made sure that at least they met certain requirements. So perhaps it is possible to look at some of these things. I mean, right now we are considering the issue of even parallel imports. Parallel imports, product has marketing authorization, but not from a particular source. Can you import it from another source? It's something to think about, because when you look at the pricing of the products, you realize that in certain markets, the prices are really low, but the price for your market, that is the authorized market, is high. So the question is, how do you deal with things like that? So we have to start thinking, I think, about trying to regularize some of these things.
Very quickly, a good point, though, is, I mean, we've struggled with this a lot. What is informal? What is formal? It varies everywhere. In Kenya, you can have a license from the municipality, but you're still informal because, you know, you lack something else. So I think for the committee, it will be important to actually, and I can tell you that for food anyway, I don't know about drugs, but for food, there is no agreed definition. It's kind of everybody knows what it is when they see it, but there's no agreed definition. So it will be something to think about.
I wanted to ask a question about risk prioritization and the, you know, sort of capacity or mindset for risk prioritization. It kind of goes back to Veronica's point that, you know, it's basically taking a step back from what's happening at the regulatory level, and how are people, what is the ability of people to look at informal markets for food, for drugs, and to pick the fights and to say, what is it we should work on, what shouldn't we work on, and how does that fit into regulatory capacity?
That's a great question, and I'd like to ask people to answer maybe with an example too, just to make it a little tangible. So, you know, how do you think about the concept of risk, but also, you know, what's high risk and what could you do about it?
I'll give you a very concrete example, and it's outside of medicine regulation. So Indonesia, as of 10 days ago, has a new regulation where everything that an Indonesian puts in their mouth has to be certified halal. Now, at the moment, that regulation applies to medicines. At the moment, it's being honored in the breach. But should that be enforced, it will cause a major disruption to the medicine market, which will cause immense shortages, which will cause et cetera, et cetera. So I think that one of the functions actually of the medicine regulatory authority potentially might be to do more of this kind of political risk analysis, but to audit other regulations, even at the point where they're being discussed in Parliament, regulations related to trade, regulations related to whatever, to say, what impact might this regulation, if any, have on the factors that create markets for informal products, that create gaps in the markets, that create unmet need, that create unmet demand, or that incentivize cost cutting. And I think that that's something that actually is not currently done by many regulators, but I think that would be useful to formalize.
Thank you. What about examples in the informal market? Delia, when you're in the informal markets, where do you see the risk, and what would you like to see done about it?
I mean, we use quantitative risk assessment. There's techniques which can allow you to assess products and hazards and come up with the burden to human health, and that allows systematic risk prioritization. There is almost no capacity for risk prioritization for food in either formal or informal countries, in the countries with which we work. The result is very clear that large amounts of money are spent on things which have almost negligible health impacts, whereas the important things are sent to the back of the queue. There's almost no conception of risk. That's what I was sort of trying to mention. People are hazard-based. If they hear that there's feces in their milk or growth promoter in their pork, they just know they don't want it. And that's, from the authorities, to the public. There is no sort of thinking of systematic risk prioritization. And beyond that, there is no capacity for regulatory impact assessment. I was talking about these trade-offs. You know, we all want our milk to be safe, but if by ensuring our milk is this level of safety, we drop infant consumption to 5% of the existing levels, what is the net effect on public health? So I see those as two of the major stumbling blocks. Some of what you were saying, why are our regulations bad? And how could we get them better? Mm-hmm. And how can we get them to be less harmful? I think if we shifted, and it has been done in rich countries, if we shifted from hazard-based systems to risk-based systems, and if we thought holistically, if we thought systemically outside just of how safe the food is, those would be two immense shifts and would lead to dramatic improvements in food safety.
Could I don't mean to put you too much on the spot here, but could you give an example of where you see a huge amount of risk that could be better handled?
Okay, well, just generally, like in many of the...
In an informal market.
In informal markets. For example, there are hazards which are causing very large health burdens, and some of them could be managed in relatively simple and cost-effective ways. And there are other hazards which are extremely difficult to manage and are causing rather negligible health burdens. So we might say of the latter, aflatoxins in milk, and of the former, Campylobacter in milk. And when we look at where the investments, the effort, the attention, it's on the hazards which cannot be managed and are having negligible health impacts, and not on the hazards which could be managed and which are having huge health impacts.
So pasteurization is
no,
focus.
not pasteurization.
No. So let's Campylobacter in milk.
Pasteurization is that one of the examples of the best is the enemy of the good. Okay. Because pasteurization was one of the most excellent public health measures ever made in Europe and America, because it was a measure which really had a dramatic effect on lowering disease. Because of the context, everybody thinks, oh, well, then we just need to get all the milk in Kenya pasteurized, in Tanzania and Indonesia, and it will not work. It makes things worse because pasteurization is inappropriate. It raises the cost. The pasteurized milk is not any safer because post-pasteurization, milk which is pasteurized gets much more contaminated and is a much better matrix for bacterial growth.
So the alternative
is in countries where there is a good tradition of either the best is boiling. And because in East Africa especially, a lot of milk consumption came from India. And in India, there has been a very strong tradition of boiling milk. And already people have a strong tendency to boil milk. So just push that on everybody. You have to boil your milk. And where you don't boil your milk, you ferment it. Fermenting isn't as good as boiling, but it will we did one study in fermenting in Ethiopia. Traditional fermenting reduced the risk of Staph aureus 200-fold. So it's where you can't get them to boil, and it's ridiculous to get them to pasteurize, push them to ferment. And there are always things you can do.
Okay. Great. Let's see. Yes, Maria Elena.
Thank you very much. This has been very enlightening panel. I appreciate all your comments. And I don't know if we're kind of wrapping up, but I thought maybe as a final...
I think we got a little time.
We have time?
We have till 2:15.
Okay, good.
I think.
So one of the mandates of the committee is actually to identify concrete steps to raise visibility of the need, of course, of having food and drug safety. And at the same time, therefore, incentivize for investment in food security and drug security. And we've heard from your discussions, the need of compiling good data, integrating maybe foodborne disease illnesses within the global burden of human and veterinary disease. We've heard maybe some of the concrete steps like using the three-legged stools. But maybe can you all comment on what would be the top item that you would really want to raise visibility on, and how would you actually do it that can create an action and an impact and be catalytic?
And just to clarify the question, are you thinking about what part of the problem would you want people to focus on? Or what part of the solution is an opportunity?
Right, so we're supposed to come up with steps it literally says, identify concrete steps to raise visibility in global food and drug security.
So really,
right?
how to capture people's
Right.
imagination and
so
focus
if you were to raise
on this
visibility,
challenge.
right, what would you really
What would you
raise?
want people to know?
Right. What would you
what's
want
the visible part?
Exact. And how would you ensure that by doing that, you're actually going to create an action and maybe even a solution?
Or even that first question is a good one. What's the visible part you want people to see if we're going to raise the visibility? And maybe we can ask everyone on the panel. So go ahead. What's the visible part?
I would say that for drugs, raising visibility means making something salient to your audience, right? So we've got two different audiences. We've got audiences in countries that have relatively secure and well-regulated medicine supplies, and we've got countries that don't, and we're talking now about trying to raise investments in the first group, in helping the second group to up their game, potentially. So we need messages for both of those different audiences. And the thing in drugs that I would say is for rich countries, essentially, to put it crudely, the threat of not doing anything to improve medicine quality in poor countries is principally about antimicrobial resistance, because if one of the classes of drugs which are most affected by substandards, that means subtherapeutic levels, is anti-infectives, and as human beings are essentially exoskeleton for bacteria in this age of cheap and frequent travel, if we're allowing a badly regulated drug supply to have lots of substandard drugs in Niger or Central African Republic or Bangladesh or whatever to get on a plane and arrive in New York or London or Beijing, that becomes a problem. So that would be the message for rich countries, why invest in poor countries. For middle-income countries, I would say universal health coverage, that essentially at the moment, many countries in which I'm working are at risk of increasing access to medicines, but not increasing access to medicines that work. So unless we're actively incentivizing quality in that increase to access, there's a risk that we're going to be increasing access to medicines that don't work and ultimately undermining the goal of achieving universal health coverage.
Those are great points. Delia?
I'd like to raise some understanding about how when regulation goes wrong and how the many examples we've had where people trying to make things better have made things worse. And especially this over-reliance on enforcement. And we see this all the time. People think it's regulation and enforcement that will get us to food safety, and it will never get us to food safety.
But even before you get to that point, there's a there that you have to be worried about trying to address. What's the most salient part of the problem? And then you can say don't do excessive enforcement.
Okay, well, let me say foodborne disease, like all disease, but especially foodborne disease, is too important to be left to the doctors. That we need to think of foodborne disease as a food system, as a development issue, as a sustainable development goal issue. We need to broaden the way we think about food safety and food. And then we will find that a whole other set of priorities and solutions come into the circle.
Great, excellent. Cool.
So in our part of the world, most of the medicines that we get are not purchased by our ministries. They're usually supplied perhaps by other programs, supported by donors. So what I really would like them to do is to understand that it's not just enough to just come and leave the product in the warehouse. There are other things that need to go with that to ensure that the product remains of good quality, to ensure that they also support the systems that are already in country rather than undermine the systems that are in country in terms of ensuring quality of products. Mm-hmm. So if products are already registered by whatever regulatory systems are there, it is important that these are supported.
Right. And what's the consequence if they don't do that?
There is no consequence to them.
Right, but
But the point is you then have to, as a regulator, ensure that you then have extra monitoring systems to ensure that those products are of good quality. Mm-hmm. So it increases your post-marketing surveillance costs, and some partners will accept that they need to also support you there.
Right.
But there are other partners that don't support
But
that particular effort.
But partly it compromises the goals that those donors
Exactly.
have. Yeah.
Exactly.
Dr. Henson, would you want to
Yeah.
answer that question?
I think two issues. One, I think we have to emphasize and really hammer home the rapidity of the change in food systems that is happening in particularly middle-income countries. It's unprecedented. And so the future challenges, well, the emerging challenges, and then the very rapid increase in challenges associated with food safety, I think is something we really do have to emphasize. We have to put to the fore. So it's not just what we see today; it's what we're going to see, coming into the future. I think the language we have to really hammer home, and Delia has just referred to it, is the implications of food safety for attaining the Sustainable Development Goals. I think the Sustainable Development Goals, the discourse, particularly in the private sector, but actually I think also in the public sector, is far greater than we saw with the Millennium Development Goals. And so we should be using the language of the Sustainable Development Goals and the importance of food safety to the attainment of a number of them, and we did this in the report. I think we can use that to put it up the agenda of donors, both multilateral and bilateral, and low and middle income country governments. So I think that's what I would say.
Great. One question as we think about this challenge, which I think we've really talked about in a lot of detail here, is there any emerging technology, just because this is a question posed to the committee, that could be helpful? I'm not thinking of a simple test for Campylobacter, but is there technology out there that could actually make this very complicated, challenge where you potentially could make a misstep and get things worse? Is there technology to help with surveillance? Is there technology to help with the supply chain that might work for an informal market, that either in drugs or food, that people have any optimism about?
Yeah, no, I think this could be an amazing breakthrough, but it's all promises and no delivery. I mean, we've been working on the edge of many of these breakthroughs for the last 15 years, but really there are many things which could be absolutely game-changing. One of them is cheap food side diagnostics. People say they don't want to eat salty, sugary, oily food, but they demonstrate that they do. Mm-hmm. People really don't want to eat food full of salmonella and Campylobacter. So if we could get the 1 cent filter paper, you put it in the milk and it turns like a pregnancy diagnosis kit. It turns red if that milk has got feces in it. No one will buy it. The other thing with supply chain, and it's blockchain. Everybody talks about big data and blockchain. I mean, one of the huge problems we have is lack of trust. These are low trust markets. Nobody trusts anyone else, and neither should they, because very few are trustworthy. And the governments and the regulators are some of the, well, let me not continue. But if we could bring in things like blockchain, third-party verification, cameras, I say, if you could just have cheap enough digital so that woman buying pork in a Vietnamese market, she can see every step, the pig on the farm, what it's being fed, how it's being carried. If you could reduce information asymmetries, as the economists tell us, get rid of the information asymmetries. Technology is not quite there, but they're on several fronts. We may literally be only years away from major breakthroughs which would solve the problem for food safety once and for all. We will never solve the problem of obesity and overweight.
Wow. I can't believe I hit a question that brought out an optimistic answer like that from you, but I'm going to take it. Other thoughts about technology?
You know that in certain jurisdictions there are certain technologies that they are bringing in.
You're going to push the button, yeah.
We use the smartphone to determine whether a product is a counterfeit or not a counterfeit. So it's possible that those kinds of technologies could be deployed, particularly where you have a huge informal market that is complicated by counterfeits in the informal sector.
Got it. Spencer, Elizabeth, any technology do you want to quickly mention as potentially.
One line, I think that technologies can help, but in general, technologies don't solve human problems. And a lot of the problem that creates these markets might help to regulate informal markets, but a lot of the problems that create informal markets are problems with incentives. Those are largely human, and those are not going to be solved by technology. They're going to be solved by better policy.
Great. Spencer, anything to add at this point?
Yeah, very quickly. I think there are very exciting things happening with very simple SMS-based technologies, with the simplest of phones that are being used to inform informal traders, for example, across the border in East Africa, mechanisms to raise awareness of unsafe products, not just in the food area, all over the world. And I think what is most critical here is technologies that are accessible to the poor. So yes, I would suggest that we're seeing very exciting things there.
Well, this has been such an interesting conversation. I'll just say that my takeaway is that there's so many complexities with these markets that they can be very local and dependent on local challenges, customs, as well as local opportunities for progress. And I personally, just speaking for myself, think that understanding the regulatory environment so you get to a good regulatory environment is extremely important, both because you want to get rid of regulations that are making things worse, and because ultimately when you try things that people can think of that might work, or things are happening, you need someone who's going to be able to hopefully have the best interest of the public at heart and be able to foster the things that work and not allow things to get worse or for people to be further deceived. So I think this has been a very interesting discussion, and I really want to thank the panelists for sharing their wisdom with us. Thank you.
So we can, at this point, take a 15-minute break. Be back here right on the half hour so we can start again.
Thank you.